Welcome to Antibiotic Answers. My name is Haley Warner, and today we'll be talking about Lyme disease. Lyme disease is an infection caused by the bacteria Borrelia burgdorferi. It is spread to humans through a bite from an infected black-legged or western black-legged tick. These are of the Ixodes species. Over 89,000 cases were reported to health departments nationally in 2023. You can see on the map on the right that they're typically found in Northeast, Mid-Atlantic, and Upper Midwest regions of the United States. The highest risk of infection is during late spring through fall. Signs and symptoms of Lyme disease vary depending on early and late presentation. In the early stage, 3 to 30 days after a bite, a characteristic sign is an erythema migrans or bullseye rash. This may feel warm to the touch, but is not usually itchy or painful. It can be difficult to see and can be located anywhere on the body. Other early signs and symptoms include fever, chills, headache, fatigue, muscle and joint aches, or swollen lymph nodes. In the late presentation, days to months after the bite, you may have severe headaches and neck stiffness, facial palsy, which is the inability to move face muscles, arthritis and swollen or painful joints, Lyme carditis, which can present as a pounding heart or irregular heartbeats, and nerve pain. Lyme disease can be diagnosed with a laboratory test. It's recommended to use an FDA-cleared antibody test for this. There's a risk of false negative test results during initial weeks of infection, and your results are more likely to be accurate after a person has been infected for 4 to 6 weeks. However, it's not helpful in diagnosis of a reinfection if you were bitten by another infected tick, because the test remains positive for months to years even after the bacteria is no longer present. Treatment of Lyme disease varies based on presentation of signs and symptoms. To treat an erythema migrans or the common bullseye rash, it's recommended to use an oral antibiotic such as doxycycline for 10 days, amoxicillin or cefuroxime for 14 days, or azithromycin for 7 days. Meningitis, which is inflammation of the brain, can be treated with oral doxycycline or IV ceftriaxone for 14 to 21 days. Cranial nerve palsy, or nerve damage in the face muscles, is treated with oral doxycycline for 14 to 21 days. Carditis, which is inflammation of the heart, can be treated with one of our oral antibiotics of doxycycline, amoxicillin, or cefuroxime, or the IV route with ceftriaxone for 14 to 21 days. Lastly, arthritis is treated with an oral antibiotic, doxycycline, amoxicillin, or cefuroxime for 28 days. Regardless of which sign or symptom is being treated, the antibiotic dosing recommendations remain the same. We can see that the adult dosing varies from 1 to 3 times a day depending on which antibiotic is being used. Pediatric doses are weight-based, with the maximum being equivalent to the adult dose. There is currently no vaccine for Lyme disease, but medication prevention with a single dose of doxycycline 200 mg should be given within 72 hours after finding a high-risk tick bite. A bite is considered high risk if the bite was from an identified Ixodes species that's known to spread Lyme disease, the bite occurred in an area where Lyme disease is commonly present, and the tick was attached for greater than or equal to 36 hours. For all other bites, it's recommended to wait and watch for development of signs and symptoms. The best way to prevent Lyme disease is by preventing tick bites. For example, it's recommended to wear long sleeves and pants that are light colored, tuck pants into socks or shoes, use an EPA-approved repellent such as DEET or oil of lemon eucalyptus. Conduct a thorough visual search of your entire body. You can see the common areas where ticks may be on the diagram on the right. Wash or shower within 2 hours of exposure to a tick habitat. And lastly, you can dry clothes on high heat for at least 10 minutes or wash them in hot water. If you find an attached tick, carefully remove it with a fine-tip tool like a tweezer. It's not recommended to pull out the tick with your fingers, as part of the tick may be left behind in the wound. Afterwards, carefully clean the bite area. Guidelines provide a tip to store the tick in a sealed container labeled with the date and likely place you got the bite. See a doctor if concerned for an Ixodes species of tick that has been attached for greater than or equal to 36 hours. Thank you for listening to this Antibiotic Answers video on Lyme disease. Please reach out to the CAP Center Antimicrobial Stewardship Pharmacist Emily Perry with any questions you may have.